This is the talk show that takes a no-holds-barred approach to politics, where truth and integrity are the standard and the Constitution honored. From Renaissance Studios, this is Champion News Talk Radio.
Good morning and welcome to another great edition of Champion News Talk Radio. We are brought to you by championnews.net, and we are your choice for the conservative voice. This is Carol Parisi. Our founder, Jack Roser, and myself today have Stephen Tucker. He is a true patriot and a health care expert. And guess what, listeners? They're doing it to you. There is more new stuff added to the health care bill, and we're going to hear about that today from Mr. Tucker. Hello, Jack. How are you today?
Oh, just fine. I'm glad this second time you've been on our program, Steve, and very glad to see you return.
Thank you.
You're in the business, and you've been competing for signing up people on health care, so you've got a pretty good idea of what you can tell people that will make them want to buy your product. So,
Indeed, yeah.
And now you're in the world of the government telling you what we've got to have.
It's so true.
Well,
Yeah.
just to be clear, Steve.
He's really. I remember you from last time here, and I'm warning everybody out there: listen closely, because you really do know a lot about a subject on which we've been fed a lot of baloney.
Oh, is that true?
We were just talking. You were talking about the vast number of regulations there are. And say once more, we're talking about a government program with what they call single payer. Well, the single payer is the taxpayer that pays an awful amount of money for this, and he doesn't get to have his say-so. And they're trying to duplicate, hopefully in a benevolent way, all of the decisions that we have to make about that important thing is about our personal care and our loved ones and our employees.
That's right.
A lot of complications in all of this.
Yeah.
And it's not at all surprising to me, I've been in business a long time, that the government's having a hell of a hard time trying to duplicate the good decisions that we make when we're in a market that we ourselves are paying for,
Right.
and know what we want to get as a service, what we want to eat. Certainly when we get to ourselves and our medical care, we know what we'd like. The government's having a hell of a time trying to tell us what we've got to like, and we're going to pay for it or not.
True. That is so true.
Or else.
There's something fundamentally wrong with that. Steve, you have traveled all over the state. You have been speaking the truth about health care and Obamacare, the implications before the bill even went into law. You saw a lot of the writing on the wall, if you will, before Nancy Pelosi said we got to look at the bill, pass the bill, then we could look at the bill. You've spoken at many Tea Parties. You're also the leader of the Chicago Tea Party, and they are lucky to have you because you have really done a lot for the cause. Medicaid expansion. What is the implication of Medicaid expansion, Steve?
Okay, recently we've seen some former staunch advocates against this healthcare law now succumbing to certain portions of it. One of them is Medicaid expansion. And so the most recent headlines were made by Chris Christie in New Jersey, John Kasich out of Ohio, Jan Brewer in Arizona, Rick Scott in Florida. These are all Republicans that were formerly against.
And some are very, very, I mean, Jan Brewer is a very conservative Republican,
person.
so is John Kasich. So
Yes.
Are they capitulating to the law?
They're capitulating to employers in their states. Here's what's happening. Medicaid is expanded under this healthcare law dramatically. So, for instance, today, using today's federal poverty levels in 2012, to qualify for Medicaid, number one, you have to have a child on the Medicaid first under our federal S-chip bill. And then the state, under Blagojevich, who, by the way, expanded our Medicaid program illegally, without any approval from our House or our Senate here in Illinois, just did it.
Just did it.
Started a program called Moms and Babies, and then started a program called Family Care, which were massive extensions to our existing Medicaid program, and then did not ask for citizenship. I don't mean Illinois citizenship.
How
I
did
mean
this get through
US
Congress?
citizenship. It did not. Blago did it illegally.
This was just for the state of Illinois.
Just
what I mean.
Illinois.
This is not
Just
a federal.
Illinois.
You're not
Who
speaking
did it
to federal.
illegally?
Rod Blagojevich, when he was governor.
He's
So-
serving his
The guy
second
that's
term.
in prison, he ought to
guy
be in
who's-
prison for this.
Yes,
Yeah.
yes. In Illinois, our governors make our license plates.
Yes.
So what happened was, now with the new healthcare law, what has to happen now is that you can be on Medicaid without having a child attached. So you can be a childless adult and apply for Medicaid and get free, quote unquote, free health insurance paid for by the taxpayer. The number of childless adults who will now qualify for Medicaid is over 9 million of them. And so now you can make between $11,141, which is today's eligibility level, and $15,144 is the new Medicaid eligibility amount.
So they're not only expanding it by the people, because now you don't have to have a child, the qualification.
Right.
They're also raising
The eligibility levels.
the eligibility, the dollar eligibility
Correct,
levels.
correct. So for instance, a family today to get on Medicaid would be making $23,000. After Obamacare passes, or it's already passed it, but once it's implemented in 2014, when the exchanges open and Medicaid is expanded in that state, that family can make $31,000 and get on Medicaid, the entire family.
$31,000 though is not a lot of money.
It's not a lot of money, no, and I'll
There's
get
a great many people that's what they make.
and I will get to what we can do with Medicaid, what
that.
we should be doing to Medicaid. But that new gap now between 11,144, we'll just use the individual now, and 15,144, this new eligibility gap right here has created a controversy in these Republican-led states, okay? Because if you expand Medicaid, if anyone gets on Medicaid and you have 50 or more employees, okay, that's where they get you with that $2,000 fine, right? For every employee from the 30th employee on up. If you have over 50 employees and your employees qualify for Medicaid, then they're not getting health insurance. They're getting a government welfare program, a bankrupt welfare program called Medicaid. When they secure health insurance, they have to make more than $15,144 to start securing government-sponsored health insurance, and they will get a very large tax subsidy, an advanced premium
Is that
tax
under
credit.
present regulations?
This is new regulation.
New regulation.
This is
Starting in
businesses.
2014.
You're talking
Pardon
about
me.
businesses.
Hold the question here. This goes into effect along with the Obamacare, spelled with a K. Yeah, it goes in effect then, or is it going in
Yes.
effect under the present law?
No, January 1st, 2014, all this begins, okay? So you're in a Republican-led state, you've got 50 or more employees. If one of your employees qualifies for an advance tax credit, that's how the president is going to artificially lower very expensive health insurance. The cost for a family in 2014 is going to be over $14,000 a year for health insurance. Because they piled on all these things that are not medically necessary. 65 quote-unquote free preventive care tests, abortifacient drugs, all these things that we don't support, many not medically necessary, they've piled them on, which artificially drives up the cost of health insurance. So when you go into the exchanges starting October 1st, you'll be able to get taxpayer subsidized health insurance. So a family making $51,000 a year, which is the average income level in 2012 according to the census for a family of 4, their cost for health insurance will be $14,000 a year. But they'll really pay about $3,200 a year because the U.S. taxpayer for just that one family will cut that cost down by $10,800 a year. And we will do that for every family across the country. Now, that's health insurance. If that person qualifies for an advanced tax credit to artificially lower that premium, they're getting health insurance, right? If they make less than $15,144 a year, they don't get health insurance. They get a bankrupt welfare program called Medicaid. If that happens, the employer is under no responsibility to pay a fine because they're not getting health insurance.
Right.
They're getting welfare. Now, in states where Christie is leading, Rick Scott is a governor, Brewer is a governor, if they don't expand Medicaid to the new eligibility level from 11,000 to 15,000, the employer will become and assume the role of Medicaid. Because now they can't get Medicaid, they can only get health insurance. And if they get health insurance, that employer, if they work for him and he's got more than 50 employees, he's got to pay a $2,000 fine for every single one of them. So these employers are coming to these governors and saying, hey, I talked to my buddy over in Illinois, they're expanding Medicaid. I don't have to pay $2,000 for every one of these people. They're getting Medicaid over there.
So actually the governors are being business
Pressured.
friendly, but they're trying to help their business.
Yes, but they're only providing relief on a micro level. They're not seeing what this is going to do to the taxpayer on a macro level. The cost to do all of this to the taxpayer is going to be gigantic. The cost to put 9 million single childless people onto Medicaid is going to cost the states millions and billions of dollars. The president says that, oh, don't worry, we'll expand Medicaid, and I got you. I got you at 100% all the way to 2022. Government's going to match it. Don't worry about it, governors. And then after 2020, I'm just going to reduce it by 10%, so it's 90-10, right? Just that 10% the states have to now pick up will cost them billions and billions of dollars. But what he's not saying is President Obama's own budget that he tried to pass, the first one, which was voted down 97-0 in the Senate, second was voted down 99-0. Both of those budget proposals call for a change in the reimbursement ratio after 2020.